All right, in some other news now, and the World Health Organization has finally declared the Ebola outbreak in the Democratic Republic of Congo as an international health emergency. The decision comes after the virus spread to the city of Goma, which is home to more than 1 million people. A WHO expert committee had already deliberated on the declaration 3 times but had decided against it. And now, with a confirmed case in Goma, the committee has no choice. The declaration will, of course, bring along with it more international attention and aid. The location of the city of Goma is also one of concern. The city is located on the border with Rwanda and also has an international airport. Health officials have already started to check the temperature of people crossing the border between Rwanda and Congo. Now, this is not an easy task as almost 80,000 people cross the border every day. However, the WHO has not imposed any travel restrictions outside the immediately affected region as of now. There were enough signals over the last few months regarding this impending crisis. About 2,295 people have been affected so far by the outbreak, and more than 1,600 lost their lives. This brings the fatality rate to a whopping 67%, and that too for a disease which has a vaccination with 99% success rate. The WHO has meanwhile called for more financial support and manpower in dealing with the outbreak. And our correspondent Chris Okamringa gets us more from Kinshasa in Congo.
The World Health Organization declared the Ebola outbreak in the DRC as a public health emergency of international concern. Now, that declaration is supposed to mobilize more funds and the political commitment of leaders to help bring this outbreak to an end. Now, the DRC government has expressed disappointment at that declaration because of the likely negative consequences that may arise from this declaration, namely the trade and travel restrictions that countries neighboring the DRC may impose on the country. Now, the east of the DRC relies heavily on trade with Rwanda and Uganda, and so people there are very worried that most of these locals who rely on cross-border trade may be affected. That will, in effect, bring another problem to the DRC. The World Health Organization says there was an infection in the city of Goma, that is the capital of North Kivu province, that borders Rwanda, and that is the reason that they made the decision to declare it a public health emergency. What this means is that the international community must step up their vigilance, put health teams in all their points of entries to check people who are coming from the DRC so that this disease does not spread. So far, there are more than 1,600 people have died of Ebola in the DRC, and it's particularly in North Kivu and Ituri province in the east of the country. But the declaration, like I mentioned, among many Congolese here is a very sad event. Many people are not happy because they are fearing that trade and travel restrictions will fall from countries neighboring the DRC.